Hello, everybody. Good afternoon. My name is Boris Azais. I'm Director of Public Policy at MSD, a pharmaceutical company. Some of you may have attended previous sessions of the Nobody Left Outside initiative in previous years. Actually, 6 years ago, we launched the initiative MSD with DGA, now previously called Interrel. We launched the Nobody Left Outside initiative here in Gastein. It's actually now one of their landmark initiatives in the leaflet that you have received when you registered. So that's we're very proud of that. And I just wanted to say a few words before the panel starts. Nobody Left Outside is a coalition of NGOs representing some of the most marginalized communities in Europe, people who suffer a particular hardship in terms of burden of disease, but also very poor, limited access to healthcare. And the concept of the initiative early on was rather than focus on specific disease, infectious disease, non-communicable disease, and so forth, the idea was to take a more transversal approach focused on people and certain communities and the challenges they face when trying to access healthcare. And one of the things that we realized working on this is that from a public health standpoint, these communities are often referred to as being hard to reach because they have hard living conditions, they're living on the street and not having papers and so forth. And what we wanted to do with this initiative is really turn this around and show that it's not really people who are hard to reach, but health systems who are hard to reach. And there, from that basis, the members of NLO, Nobody Left Outside, have worked on promoting the issue of access to health for marginalized communities. Throughout numerous activities, there is a website you can check to see it. It was recognized actually by the European Commission, by the WHO. NLO was a thematic network at some point for the EU Health Platform. And really, if today we are talking about marginalized communities at the highest level of EU policy, it is thanks to the work of NLO members and this coalition. So today, 6 years later, we strongly believe in health in all policies, and so with partnering with the Wellcome Trust, we felt that it was quite topical to approach the topic of access to health, marginalized communities, and climate change. And I'll hand over to your moderator of today, Sue Saville. Thank you.
Thank you very much indeed, Boris. Yes, it's wonderful to hear about how far you've already come with NLO and to know about what's looking ahead in the future. My name is Sue Saville. I'm a medical and health journalist. I was with the BBC and ITV News in the UK for many years, and it's my great pleasure to be guiding the discussions here today. And these discussions, of course, are looking at that intersectionality between climate, particularly climate change, and health issues. And for the sessions you've probably already attended, it keeps coming up. It is a very topical issue. It is very, very important, indeed critical, in looking at the health across the European Union. We're going to be diving deeper into this, and as Boris was saying there, looking at those who are perhaps underrepresented, and as Boris was saying, maybe not so much the hard to reach, but they're the ones who find it hard to reach the health services and the systems there. So we want to explore how the EU can focus and can prioritize better how to help these communities that are more marginalized, and looking at perhaps their overall long-term climate change plans so that the region can have a more comprehensive and indeed more inclusive, healthier, prosperous future for all. So we have a 2-hour session. There's no official break in it, but if you do need a comfort break, quick bit of water, you are welcome to tiptoe out, but you must come back, okay? Because I'm going to be counting those out and those in. But it's great to have this opportunity, and we're structuring it. The first half is going to be a panel discussion with our expert speakers. If time allows, we will take questions in the room with a roving mic, we'll see, but you are going to be participants in part 2, the second hour, when, as you may have realized, you've been invited to the World Cafe. Now, did somebody promise gin and wine later? Oh no, sorry, that was, no, maybe not. No, wrong one, yeah. You get a glass of water, maybe. So you're all at the World Cafe for later, and we want your input. There are 3 key themes that we want to discuss and brainstorm with you. There are 2 tables for each theme. We will have facilitators on each of those tables, and there will be opportunities to be very creative. Bring out your inner child with the crayons. Write down some thoughts, perhaps even a little sketch, and we will come to the end to bring thoughts together. So that's the idea of how it's going to go, and we very much want your participation in that. So, now that Boris has set the scene, I'd like to invite 2 of the key people in this partnership, the Nobody Left Outside and the Wellcome Trust that Boris mentioned, to give them a chance to explain to us a little bit more about how important this collaboration is and what they might achieve. So please join me now in welcoming to the stage Freek Spinnevin, the Director of European Homeless Organisation, known as Venster, and Catherine Guinard, who is the Europe lead at the Wellcome Trust. Welcome to you both, indeed. Do you want to take a seat? Freek, perhaps I could invite you first to tell us a little bit more about how your organisation is helping marginalised communities, particularly with this focus of climate and health.
Yes. But first of all, thanks again for the invitation. Happy to be... sorry. Happy to be here again. Maybe just first say that NLO has a special relation with Gastein, like Boris already said. I think we could argue that we were born in Gastein, and that the different sessions like this session that we have had have sort of helped us to gain visibility for the network and also gathered strength of the network. So I hope this relation can continue in the future as well. We have become some kind of a fixture of the Gastein session, fixture in the positive sense of the word, of course, and I hope that we can stay a fixture. So thanks, people organizing the event here, for that opportunity. And of course, the support for this session from Wellcome and the interest in the topic is really important. The hook at the moment is climate change. Climate change and marginalized communities, very topical at the moment, politically extremely relevant, also at EU level. But even if that's the hook, I hope, but it's just a hope, that we can further broaden the perspective with Wellcome after this. And why is this issue of climate change, climate mitigation policies and marginalized communities so important? I think that it is because at the moment, and you hear it here throughout sessions, that the link between health and climate is a bit too binary. We assume that if we invest in a better climate, that it will necessarily increase the health of the population. But that's not necessarily the case if you talk with, if you think of very marginalized communities. I think we underestimate in general the social impact of the climate change. Climate mitigation is expensive, often expensive, and some people cannot afford it, and if you cannot afford it, you will be more excluded, and the extra exclusion will impact negatively on your health. And I think we have to be aware of that. Like, of course, I'm not arguing against a better climate and investment in a better climate. That's clear. I'm arguing for a more sophisticated understanding of how that impacts on marginalized communities and what we can do about that. That kind of mantra that environmental progress, social progress, and health progress go hand in hand for everybody, we should try to challenge that a little bit. And there is, of course, the time dimension there. Over the long term, it is probably true for all population, but very marginalized communities have a different time perspective. They think about how I'm going to survive tomorrow. And that is really difficult in this whole debate. So that's why I like very much, and thank again, Wellcome, for the opportunity to discuss this particular topic.
Thank you very much indeed. Catherine, over to you as the Wellcome Trust representative here. And I'm wondering if we need to define the marginalised communities, those groups. Which ones are we actually referring to?
I don't know if I'm better off handing back to Freek to speak on behalf of NLO for that question before I kick off.
Shall we just define our terms at the outset here?
Who we are.
But in terms of those groups, are we talking? We're talking about the homeless people. We're talking about perhaps drug addicts. But how wide are the groups?
Yes, and sorry, because I think after 6 years we take for granted that everybody know who we are. But maybe that's that we shouldn't do that. Like the groups that we represent are groups that are very marginalized, really disconnected from the mainstream health system and consistently overlooked by health and public health policies. And that's indeed the homeless population. It's my organization works on that, but it's sex workers as well. It's undocumented migrants. It's prisoners. It's people who inject drugs. Can be trans people, etc. So, but I think what is unique about it is that it's bringing together groups that are not just vulnerable, but extremely vulnerable. And I think it's important because certainly at European level, if the phrase vulnerable people or social inclusion or health inequalities is mentioned, people think about the broader groups in society. And these groups that I just mentioned are consistently overlooked, not deliberately, but consistently overlooked. And so gathering them together to give them a voice, I think it's really important.
That's very helpful to define that. Thank you. So, Catherine, the importance of this partnership then?
Yeah, I'm really excited to be here today, really excited by this partnership and already by Freek's introductory remarks. I know that this is going to be a fascinating session. So I'm Kathleen Nard, lead at Wellcome Trust, which I think a lot of people here will know us, but we're a philanthropic organisation that aims to improve health through research. And we've got a focus on 4 broad but very porous areas. So discovery research, infectious disease, mental health, and climate and health. So we're a funder of research, but we're also an advocate for change across those priority areas, in particular in a way that improves things on the ground for communities most affected, wherever they are in the world. So that's a bit of an overview, and that probably, I hope, gives an insight into why I was really interested in collaborating with Nobody Left Outside on this session. So there's a growing body of evidence to demonstrate that climate change is both a health crisis in its own right and a fuel that kind of fires and inflames other health crises in Europe and worldwide. And in the years to come, as climate change inevitably, sadly, worsens, so will its impact on our health. And our ability, the ability of health systems to continue to protect our health in the future relies on our collective efforts to tackle climate change today. As Freek alluded to, the health of marginalised groups in the climate action discourse needs particular attention because it's incredibly complex. And I don't want to kind of delve too far because I think there are other people on the panel who can explore this in a far more nuanced way than me. But I think the way in one of our very early calls it was explained to me is that the impact of climate change on the health of marginalised groups risks impact them in 2 ways in comparison to the general population. And the first is that marginalised groups often have poorer health as a baseline. And so as climate change in the years to come, well, already it's impacting our health, but as in the years to come, it worsens our health. Marginalised groups who already have health problems, the risk for them on their health is even worse. And also, we mentioned access in the beginning of this session, and these are groups that are already struggling to access healthcare systems. And so as healthcare systems become increasingly under strain because of climate change, as well as for other issues that we've discussed this week, that risks leaving marginalised groups even further behind than they are today. So it's an incredibly complex situation, and I think there's a lot that we still don't know, and better understanding how climate change is impacting the health and well-being in a general sense of marginalised groups is the foundation of creating evidence-based policy, which really, to Freek's point, is absolutely fit for purpose. And that's why I'm really pleased that Wellcome has been able to support NLO in recent months in kind of organising and thinking through this session. I think it's the start of a journey for them on climate change and health, but it's been really exciting to kind of think through some of the issues involved. I'd like to close. I don't want to talk too much because we've got a lot of speakers today, and I'm really looking forward to the session at the end when we can all kind of talk together. But I wanted to close by kind of flagging that at European level, there's two big opportunities right now to advance a climate and health agenda that foregrounds marginalised groups. And the first, of course, are the European elections. So there's been a lot of discussion about the European elections this week. And a lot of discussion of health priorities, which are all really important and all warrant their own individual attention and focus in their own right. But I would suggest to organisations in the room and joining online that in our advocacy, we need to be building in the exacerbating impact of climate change on these existing conditions and the impact they have on health systems. And similarly, to be recognising that action on climate is action on health. And similarly, I'm sure we're going to get to the Green Deal later in this session, but like thinking about new climate legislation, which absolutely needs to happen in the next mandate, but making sure that new legislation is, first of all, embedding health at its heart from the outset, but in particular is taking care to vulnerable groups and making sure that genuinely nobody is left outside, because that's really only how effective successful policy can really land. My personal view, I've been kind of working on EU policy for many, many years, is that this legislature has been really strong and ambitious, I think, on health and climate, and I'd love to be challenged by others. but I think, you know, as advocates, we always need to be making the case for more, to maintain and to build on that ambition. And also, I think, through the next legislature, to be building a kind of a shared agenda for climate and health, so drawing those agendas together. And the second opportunity, I think, to kind of take action on climate and health, I think, is something that maybe is less front of mind to people around the room because it's a little bit further off, and that's the development of the EU's next research funding framework programme. So at the moment, we've got Horizon Europe, but thinking is already underway for the next framework programme that's starting in 2027. I mean, the EU is home to the world's largest multilateral funding scheme, so it's absolutely the place where we should be exploring getting to grips with data gaps on climate and health and affected communities, and in this case, marginalised groups in particular. And so as health advocates, we really need to be kind of leveraging the power of that research, and also to be making sure when we're talking in our calls around research, be saying it's absolutely important these communities need to be brought in from the get-go to these research projects. And as these research fundings are kind of coming through and the evidence is being pulled through to policy, that again, marginalised groups, affected communities are really at the heart of that process. So we're really bringing them in from the get-go. So I'm going to stop there, but I'm really looking forward to the discussion today. It's really great to see such a busy room. So thank you.
Thank you very much, Catherine. And I'll invite you to join the audience. I know you're going to be facilitating some of the roundtable World Cafe discussions later. But it's been great to get the scene set then about the partnership between NLO and the Wellcome Trust, and to find out further how we can progress things and make some of those actions that you allude to there to come to life. I'd like to invite our panel up to the stage. We have two in the room. Natasha Azzopardi-Muscat, who is with the World Health Regional Office for Europe, where she's the Director of the Division of Country and Health Policies. Do come up. I'm sure I saw you somewhere else on stage this morning, Natasha. Welcome. Also in the room, we have another colourful lady, Milka Sokolovic, who is the Director General at the European Public Health Alliance. Welcome to you too. Do take a seat. We've outnumbered you there, Freek. Yeah. Yes. out-coloured, outnumbered. But online we have two more speakers who I hope we'll be able to bring up by the magic of the internet. We have Marina Romello, who is the Executive Director of the Lancet Countdown. And that's an annual publication which looks at international efforts on health and climate change. And also online we have Elina Bartram. Now she's the Director of Adaptation and Resilience, Communication and Civil Society Relations at DG Klima at the European Commission. So, welcome to you all. We do have some faces on screen, that's fantastic. So to get into this, I'd like to ask each of you to give a little presentation. We're going to consider firstly the challenge that's out there. What do we face? And with this, you've all got a couple of minutes. I'm going to keep you to time. Freek, over to you. You've given a little bit of an intro, but tell us a bit more about the challenge, please.
I'll try to do that in 3 minutes.
Yes, you've got 3 minutes. Otherwise, my water pistol comes out.
Yeah. It's difficult. I think to reformulate the question is like, how are homeless people affected by it, you know? And then that's basically the challenge, how to deal with that. And I think there is obvious ways how climate change and climate mitigation policies affect homeless people. Very quickly, two obvious, very visible impacts. When I started in France 20 years ago, you had in all countries winter plans, winter emergency plans for homeless people, for rough sleepers, people who live on the street. Now you have heat plans. Because heat can be as dangerous and sometimes even more dangerous than cold for people living on the street. So that you see even in the north, in the UK, etc., you see heat plants being launched specific for them. Of course, cold winter plants and heat plants are not a solution to homelessness. You have to house them if you want to solve homelessness. But still, that's an interesting development. I read also, related to that, very interesting research very recently, that heat is related to disproportionately more hospital admissions for homeless people. And it starts as from 25 degrees Celsius. So I think there is room to investigate that a little bit better. But the impact of heat on people living on the street is obvious. Second obvious impact is extreme weather damage, so damage from extreme weather, floods, etc. People might lose their houses and become homeless. It's another type of, it's the most deserving kind of homelessness. Like if people lose their houses because of natural disasters, policymakers will immediately intervene. Even the EU has a scheme, the civil protection mechanism, to intervene. So these are two obvious ones. But there's other impacts that are less visible, but probably as important. One is the impact of climate mitigation policies at EU level. In the framework of the EU Green Deal, I'll give you one example very quickly. There is new legislation on energy performance of building standards for existing buildings. The European Union wants all existing buildings, houses, to be energy performant, have a certain level of energy performance, minimum energy performance. And that might, without going into detail, increase the rents of people. The logic behind it is that people pay high bills, energy bills, because their housing is energy inefficient. If you make their housing energy efficient, the bills will go down, and the cost of the renovation can be compensated by that. Our concern is that there is quite a lot of people living in cold homes. They have heating, they don't use the heating because they cannot pay for the heating. For these people, it is an extra cost. And if you pay already a lot of money for your rent, it might lead to evictions. And we think that we have to prevent at all costs what we call renovictions, evictions in the framework of a renovation.
Renovation.
Because that will produce more homelessness, and we have to avoid that. Now, if you make that comment, the Commission will say, yes, but there is a social climate fund. 86 billion euro to deal with the social impact of the climate fund. Well, it's by far not enough. It's much broader than buildings, the social climate fund. But if you just take all poor people and you want to give them a heat pump, for instance, a heat pump can easily cost 5,000, 10,000, 15,000 euro. And that's just assuming that your house is ready for a heat pump. You can give 5,000 euro for every person currently in a house where they struggle to heat or to cool it properly. So it's by far not enough. The impact is potentially huge. So that's a clear example. And another less visible example of the impact of climate. And another impact is another less visible impact is potential climate refugees. Mm-hmm. There will be more and more refugees coming to Europe because of climate reasons. And in the context where there is increasingly harsh migration policies, how the ministers of migration are meeting today to agree on stricter asylum processes, etc. Like, it's obvious that these people will continue to come, but they might probably not qualify for asylum. They will be here somewhere in limbo, hidden, or become homeless. And that will impact on their health, obviously. So I think that whole issue of climate refugees and how we deal with that in Europe, I think it deserves a little bit more attention.
Thank you. Natasha, from your perspective, what would you see as the challenge, or as Freek puts it, about how these communities are more impacted by climate in their health?
Thank you, Sue, and thank you to NLO, and welcome for inviting WHO Europe to this session. And I'm very pleased today to speak on behalf of my colleagues who for the past 2 decades have been running our program on climate change and health from our office in Bonn. And recently also our office in Venice conducted an analysis where we actually looked at the policies and the greening policies being put in place. And we were very concerned because we found that the equity lens is missing. So there's, of course, a lot of enthusiasm for the right reasons, as Freek was saying, to green our systems. But if we don't take this equity lens into account, it could be that we are already throwing people who are struggling further into difficulties. So the first recommendation is that whenever we're looking at greening policies and plans, we need to ensure that we apply an equity lens. Secondly, our office in Bonn has been working very much with countries on adaptation plans, on heat plans, etc. And again, over here, we need to make sure that they take marginalized communities into account. Freek, you were speaking very clearly about the homeless people. Let's speak also about people perhaps who may not be sleeping on the streets, but people who are working long hours in fields in southern Europe, most of them migrants. These are really being impacted. Let's speak also about indigenous communities. Yesterday, our regional director, Dr. Hans Kluge, spoke about his trip to Greenland and the way in which climate change is really impacting these communities. Let's go to the Western Balkans, for example, where the impact of flooding on communities with poor or substandard housing. We saw recently the impact also in Libya. So the message is that we need to all our efforts on climate change to apply this equity lens, and we need to be able to think about the impact on marginalized communities. And this was one of the topics that was also on the agenda when we had our ministerial conference on environment and health in Budapest, where again we were looking at the triple crisis, and climate change is the first pillar of this triple crisis. But the question is not the what, we like to say, but the how. So if we want to make sure that we do have this equity lens, if we want to make sure that we are not forgetting and being the first ones to leave behind as policymakers the needs of marginalized people. And let's not forget, Freek, also, that this applies also to a lot of homeless people, that they carry a dual burden in the sense. They carry the burden of being marginalized or of being homeless, but they also tend to have the burden of already having non-communicable disease because of lifestyle, because of risk factors. So that also already puts them into a higher risk category. So I'm really not surprised when you quote this study about hospital admissions, because we're talking about people who also are likely to be cardiopaths, who have mental health problems. So they are already going to be more vulnerable also from a health status condition. So when you then combine the poor health with the climate exposure, you really are dealing with a very, very complicated problem. But there is a solution, and the solution conclusion is that when designing policies, we need to make sure that we take this, we don't forget about these people. How don't we forget about them? By working with civil society, by making sure that the processes of policy development are not elitist, but are truly participatory. And I think this is perhaps one of the things that I would like to leave as a key message. Let's not make climate change just something that the elite can engage with, but let's really make it accessible to everyone to engage with. And that way, we don't make decisions ourselves for other people, but we listen to them, we engage with them, and we ensure that we really have the full perspective to have the whole picture, because otherwise we will risk missing key populations and marginalized communities who are already falling behind.
Thank you. Well, let's put those points then. Let's go directly to DG Klima, where we can speak to Marina, I think, because you've put some very specific points there, Natasha, about what needs to be done, about taking policies to take into account all of these conditions. So I'd like to invite now Elina from the DG Klima to give us your perspective, please, on this.
Thank you, and thanks for having the European Commission here. Much has been already said about the political opportunity that this coming year represents with the European parliamentary elections and the preparations on the priorities starting as of now, in fact. It's indeed true that as policymakers, we do pay special attention to the most vulnerable groups who have the least means to deal with the negative consequences of climate change. So what I'd like to say is that we're not ignorant to these matters. We have indeed set very ambitious climate targets in the Green Deal, and we're pursuing ambitious mitigation policies, but in parallel, we work on policies regarding adaptation and increasingly preparedness, so minimizing the risk of exposure to climate change. This trend will only increase as we do see that the climate impacts are getting more and more extreme, and indeed different parts of society are being impacted. As was already said, those most affected tend to be those already at a disadvantage, such as the homeless people, because of their age, health, or socioeconomic status. And if we don't consider and strengthen equity in adaptation, these existing inequalities may be exaggerated and new inequalities could arise. Climate migration or climate refugees was mentioned. We in the Commission still use the prudent language of climate-induced displacement of people, as the kind of climate refugees implies a direct link, whereas we often consider climate to be an accentuator or amplifier of already prevailing challenges on the ground. A couple of things on what the EU policy frameworks are already doing on climate adaptation and health. Firstly, we have European climate law, which formulates a legal duty to adapt. This applies to relevant union institutions and member states insofar as they must ensure continuous progress in enhancing adaptive capacity, strengthening resilience, and reducing vulnerability. It's the so famous Article 5 of the European Climate Law. Climate law also requires EU and national adaptation policies to focus in particular on the most vulnerable and impacted populations and sectors, and identify shortcomings in this regard in consultation with civil society. So what was said previously about consultation and inclusiveness is enshrined in the European climate law. Consequently, as we speak, there is an ongoing first assessment of member states' progress on adaptation, and we are checking how these duties were addressed in the various member states. I already now know, based on the preliminary findings, that the progress has been uneven, but this is a process where we are also learning by doing. We have further issued new guidelines for member states' adaptation strategies and plans this summer, and these guidelines stress the importance of including just resilience considerations in every step of adaptation planning and of involving those affected in the process. In 2022, our colleagues in the European Environment Agency published a report towards just resilience, leaving no one behind when adapting to climate change. And this report looks at how climate change affects vulnerable groups and how these impacts can be prevented or reduced through equitable adaptation actions. These aspects have also a prominent place on the portal of the European Climate and Health Observatory, which we run together with the EEA and other partners. This observatory also features newly developed pages on Map Viewer, which shows the exposure of vulnerable groups and social infrastructure to climate risks. Now, if we look beyond Europe, we should not forget that many communities in the other world regions are significantly more vulnerable to climate impacts than we are in Europe. The EU adaptation strategy therefore includes many measures to address the disproportionate climate impacts on vulnerable groups and human rights in parts of Africa, in small island developing states, and in least developed countries. The Budapest conference is something that we very much support, as the ministerial declaration points to national plans on adaptation, climate and health. And this is somewhere where we want to work very much together with the WHO to make sure that these important issues come to focus. As global warming advances, this needs to become even more important. I'd like to thank all the organisers for putting the subject on the table today. It's not an easy one, and as policymakers, we don't have the silver bullet. However, it is through these conversations that we can definitely get better in doing what we need to be doing, and also take care of those parts of society most in need. Thank you.
Thank you, Elina Bardrum. And I know that you can't stay with us long because you have a rather busy job there at DG Klima. But so let me just put a couple of things. It's very helpful to get that outline about what the Commission is already doing. But as we were hearing that we expect climate change issues only to get worse. So is there something further you'd like to see done in terms of whether that's partnerships or any further measures that you would like to see that are not on the table at the moment?
Well, I do think that there's a lot of early warning and anticipation tools that have been developed together with the Joint Research Centre. We have drought observatories, we have Copernicus that can give pretty very good predictions of different extreme weather phenomena. But unfortunately, these tools are not yet applied systematically by policymakers and planners at the member state level or at the European institutions level either. So what we're carrying out now is a very extensive European climate risk assessment. And we will have that report ready together with the Environmental Agency around March, April next year. Now, Catherine was previously referring to the sequence of European Parliament elections, the new Commission, etc. The report will feed into that debate and inform the identification of priorities. And we will be looking at the sectors that are most exposed to the risks and impacts of climate change, notably health, energy, built infrastructure, agriculture, and other key areas where we can improve our readiness and resilience. But this has to be a joint undertaking between the stakeholders, civil society, who need to be articulating their demands in this space, as well as the national administrations and the Brussels Centre of Planning. So what do I want to see? I want to see more conversation like the one we're having today, and really radical scaling up of our efforts and making things much more systemic. Thank you.
Elina Bardrum, I'll let you get away to save the planet. Thank you very much indeed for joining us online. Thank you very much. It's been super having you with us. And I'm going to turn now to... Thank you. Bye-bye.
Bye.
Yes, a round of applause. I'm sure there would be questions for her, but I know she's got to race away. Marina Romanello, also online. Lovely to see you there. From the Lancet Countdown, and we do have Slido.com, it says, with the hashtag WAVE. So if you want to join Slido.com and pop your questions in there, you've got that QR code, which, as you all know, stands for quick response. So do pop any questions in there. We'll take what we can. But Marina, it would be very interesting to hear your take on the data, the research, what we know, and what actions are being taken already.
Thank you so much, and thank you for the invitation to be here. There has been some quite outstanding speakers before me, and everything that they said is something that we're seeing in the research and in the data. So I will try not to repeat much of what has already been said, but one thing perhaps that is quite noticeable from our end, from the research side of things, is that while we have evidence on the disproportionate impact that climate change is having on the most underserved, marginalized communities in Europe, data is still really scarce, and we're still not monitoring the vulnerabilities and the disproportionate impacts on these communities. Those that are most affected are often the ones that are less visible in our data collection efforts. So we really need to increase our capacity to capture and not make them invisible, which is something that is an active effort, bringing visibility to the disproportionate impacts of these communities. But from the little evidence that we do have, what we're seeing without any hint of a doubt is that those that are most underserved, those that are living or that are homeless, or that are living in marginalized communities or poor areas of every city, are being disproportionately affected. They are hardest hit, but importantly, they're not being able to access the adaptation efforts that are unfolding. And that is what we've been hearing with very interesting examples up until now. But one thing that is also critical is to ensure that in our response to climate change, and particularly in our mitigation efforts, those communities are also not being left behind. We already heard a bit about the problem of gentrification, of our active efforts to improve our homes, our dwellings, ending up increasing the price of those homes, increasing the price of the rents, and therefore leaving people that are the most vulnerable unable to afford them. But we see the same across the scope. In the way that we're responding to climate change, what our data is showing us very clearly is that Europe is doing enormous progress in terms of both adaptation and mitigation. But when we dig down at a subnational level, what we're seeing is that those efforts are not homogeneously distributed. And oftentimes what we see is that, for example, when we try to phase out fossil fuels in our transport systems, that ends up reducing emissions, reducing air pollution, but mostly in the most affluent areas of cities. And it is the most, the poorer communities, the most marginalized communities, and those that are living in poor conditions that are the most affected by the persistent emission of fumes, air pollution, and the lack of access to those mitigation techniques. Same happens when we think about greening our cities. Greener cities are incredibly helpful to our mental and physical health. They improve our well-being, and they help reduce carbon emissions. They help mitigate as well as adapt, reducing temperatures in urban areas. But what we're seeing is that green spaces are generally in most affluent areas of cities. And when they're implemented in less affluent areas, they lead to gentrification. They increase the price of those areas, again, leading to marginalization. And that happens across the scope. So one thing that is really important to keep in mind is that it is not only about how we enable access to adaptation efforts and how we protect and reduce the vulnerability of marginalized communities, but also the way in which we transition to a new world order, in which we transition to low-carbon communities, ensuring that we're not amplifying inequities, that we're not increasing that gap, and that we really make sure that we're leaving no one behind. And that is particularly important if we take into account the health implications of that transition, air pollution, unhealthy and affordable healthy diets. All of those make up an increased inequities in Europe. Again, our data shows us very clearly that that is happening, but we still need much, much more monitoring of the interventions as we implement them to be sure that we are not generating unintentional harms and that we can course correct in time. So much, much more needs to be done in terms of monitoring and evaluation of our climate change actions.
Marina, thank you. And I know you're also rushing off. So with the data that you have, with the research that you've done through Lancet Countdown, how would you like to see policymakers and healthcare professionals perhaps translate that into what they do?
Look, we have very, very clear actions that need to happen. I spoke a bit about air pollution. Air pollution runs across the scope of climate change mitigation. And what we really need to see in Europe is that when we implement interventions to reduce emissions, to mitigate against climate change, we keep in mind the health implications of those interventions. We always say we need to keep health at the center of climate action. When we deliver those transitions, if we keep health into account and we prioritize health outcomes, we will need to make sure that those marginalized communities are not disproportionately affected. We will have to keep into account the health inequities that define many populations across Europe and ensure that we're reducing those health inequities through proactively addressing their problems, proactively monitoring the health outcomes, and proactively ensuring that in the implementation of interventions, we're not neglecting those that generally are most neglected otherwise. There's quite a lot that we have published and we have said in terms of adaptation and mitigation, but the common denominator is keeping people and their health at the center of those actions.
Thank you very much. Marina Romanello from the Lancet Countdown, thank you for joining us. Thank you.
Thank you.
So, Milka Stogolovic, what are the solutions then for politicians? You've heard about the challenges, you've heard about some of the data, there's evidence, we've heard about, everybody seems to be wanting to go in the right direction. What do you make of it?
Okay, before I turn to the role of civil society in this space, let me make two observations. One is related to Freek's comment of the NLO being a standard fixture of the Gastein Forum. I don't think it's. I think it's evolved. It's not a fixture anymore. It's not a badge. And that, I think, is demonstrated by the fact that this session doesn't take place at 6 o'clock in the evening and doesn't compete with a dinner. and the second, or 7:30 in the morning, right? And I think the second demonstrator of the fact is this full room today. And we are discussing a very tricky topic, and also a topic that doesn't necessarily relate to us all, right? Okay, so just to say that the NLO has been seen, recognized, and that's really really congratulations to the initiative, wholehearted. Okay, so it's obviously critical to highlight this disproportional health burden faced by the marginalized communities in the face of changing climate. And as we have seen already, and as the IPCC 6th report has heavily referenced, the marginalized communities are suffering more, are standing to suffer more, but also they start from a position of increased vulnerability and decreased resilience. So it's really imperative to address this issue. Now, I would like to bring another point to the discussion, and that is that with climate crisis, we also see a crisis of justice. We see a crisis of international justice, because the countries that have contributed least to the changing climate are already suffering most. We see a crisis of intergenerational justice. Those paying most are not born yet. And also, we see a crisis of health equity and health justice. The marginalized populations are much more affected by climate change than the non-marginalized, and that's a fact. That's where we start from. And think of Roma populations and flood. Think of lower socioeconomic groups and heat waves. We don't need more demonstration of it. So how do we solve it? Natasha has already pointed to it. We solve it through the right policies, right? We cannot rely on industry or on technology to solve this issue, or to build a market that will solve this issue. We have to solve it through the policy. And the policy needs to work for everyone equally. And policy is then what signals to the rest of the society what is the path that needs to be taken. And for that, we need political leadership. We need courageous politicians, and we need policymakers who understand that it's their duty and responsibility to protect health, including that of the most marginalized among us. Now, with the competing interests, and we need to acknowledge them, we need a voice that connects the health harm that is felt through the environmental injustice, if you want, and the levers, right, of policy and power. However, the most marginalized among us do not have that voice. They do not belong to this lovely, bubbly world of policy making. They need their voice being heard and transferred further. And this is where I see the space of public health civil society and the role of public health civil society. So what do we need to do? Well, Freek's organization, IFA, many other organizations in this space, we liaise with these communities, we highlight the issues, we identify the critical needs, and then we package all these into parcels that make the decisions for policymakers easy, logical, and necessary. And then this is actually the role of civil society in this space, the bridge between the affected community and policies. And only by having the foot in two worlds, in both worlds, you can achieve that. And Natasha has already referred to it. So let me give you an example that links to the air pollution that Marina was bringing up. So if climate change was to be mitigated, according to a piece of research from 2018, the cost of mitigation would be offset just by the prevented harm from reducing air pollution during the process. And as air pollution disproportionately affects the most marginalized, then they would stand to benefit most from this. And then that brings benefit to all of us, to the entire society. So, see what I'm doing there? I'm offering you an example of public health advocacy because I'm identifying the co-benefits, and I'm showing that by protecting the most marginalized among us, we all benefit from it. So this is the role of civil society in this game. And I will stop here. But let me close it with a quote of Gandhi, who said that the true measure of any society can be found in how it treats its most vulnerable members, and vulnerability and marginalization are actually the biggest issue in this climate change and health discussion.
Thank you very much indeed, Milka, from the European Public Health Alliance. We are tight on time, but Natasha, is it correct that you're not staying for our World Cafe? So I'm going to give you a chance, although we're running over a tiny bit, to have a quick comeback on that from all that you've heard. Very briefly, what do you make of that and where does that take us?
Thank you very much, and thank you for giving me a second chance. I mean, Milka, I think you really made some key points, especially this last point. We've seen it in other areas. We've seen it in disability and other areas. When we really think of those who are weakest, everybody can benefit. But I think it's naive to sort of just imagine that we go with this mainstream approach. It's not going to be enough, and it's not going to work. So I'd like to thank again NLO for having put this on the agenda. I mean, climate change is so big that if we just every time continue to talk about climate change, we won't really get into the issues. So I'm glad that we are now able, for example, to start talking about how we repackage our health systems to take into account climate change. Concretely, what does this mean for primary care? What does this mean for the health workforce? What does this mean for our hospitals? Similarly, it's good also to look at the intersections between climate change and other areas. And this is what we hope to do as the WHO Regional Office for Europe, because under the leadership of our regional director, we will be setting up a climate commission. And I hope that we will be able to walk the talk, leading by example, and make sure that this is a fully participatory also process, as we have done in other processes. Thank you.
Thank you, and I'm sure we'll come back and check in on you on that one. Thank you very much to all our panel, to our online guests who've disappeared into the ether, and to our lovely guests here on stage. Thank you very much for those initial discussions. And this is the point where we change up the format a little bit. Everybody joining online, don't go away. You can stay with us. Natasha, you are allowed to escape. And we would very much like now, thank you so much, Milka, to invite you to our World Cafe, where you're at the tables and we're going to have the key themes for discussions. Some of our speakers are going to be facilitating your discussions. We want to brainstorm. You've heard some fantastic ideas there. Everybody wants the same direction. How can that be achieved? So those online, you can see some of the QR codes and dive deeper into further information on many of these topics, but come back to us in about half an hour or so when we'll be summarizing everything. Meanwhile, you're on your tables. After 15 minutes, we're going to ring a bell. I have a bell. And you can move to another topic. But I very much hope you're going to give us all your thoughts on what can be done to make a difference here. Thank you. Very much indeed for your participation. You're all having far too much fun in this World Cafe, I think. Too much giggling. Although I did hear somebody say it's complicated, and I think the topic certainly is. Welcome back to everybody rejoining us online. I hope you found delving into those QR codes really helpful for the extra information that you found there. It's great to have you back with us. So, in the room, we have all our participants who've been scribbling away on the tables, and I'm delighted now to welcome a couple of members of NLO who are joining us online. We have Louise Bono, who is the Advocacy Officer at PICUM. That's a network protecting the rights of undocumented migrants. Another NLO member who will be popping up by the power of the internet any moment now is Keenan B. Russell, Senior Policy Officer at ILGA Europe, which is the regional umbrella group of the International Lesbian, Gay, Bisexual, Trans and Intersex Association. Welcome to you both. We can see you. I hope you can hear us. We're going to, in a moment, go round each of our tables to hear what amazing brainstorming they've been doing. But first, perhaps I could put a question to each of you that's come in online from our Slido. We've been asked about that participation. We were hearing earlier we need to get more monitoring and participation of those marginalized groups. How can that happen? How can the information be gleaned? How can those groups actually be reached? Are there any good models for this? Keenan, what do you think?
Sure. First off, thanks very much for having me. I'm glad I was able to join, if only virtually. I hope you can hear me.
Yes.
So I think one of our key suggestions as ILGA Europe comes from what we've learned from the recent humanitarian crises that have happened in the continent, which is that when decisions are made about planning and about how states and governments are going to respond to crises, it's really necessary that representatives of marginalized groups be present at the table to point out where there might be gaps in understanding or unexpected consequences of policy decisions. For example, around the COVID-19 crisis, not on the European continent, but in other continents, there were days of the week where men or women were allowed outside, and transgender people and some intersex people were thus afraid that they couldn't go outside at all to do their grocery shopping because of gender markers on their ID documents, et cetera. I provide this example to say that there are things that seem perhaps innocuous if not everyone is able to reflect on how they might pan out for groups that are not generally at the table for these kinds of conversations. So our clear suggestion is when creating the panels or the committees that are doing climate crisis planning and thinking through of how different policies and governments will react, or even at the city and local level, that they ensure that marginalized voices are represented from the very beginning in those planning conversations.
Well, thank you. And Louise, turning to you, how can that actually then be realized? How can you find those participation models that Keenan wants to talk about there? What happens on the ground to reach these people?
I think maybe what I can best reflect on, and I completely agree with Keenan what he said, but I think what I have to highlight from our sides, because we work on undocumented migrants and for undocumented migrants, they already are a group population that are excluded from the very outset from the system, right? They're invisibilized because they won't have the right papers. And so I think we need to involve them, and we need to involve organizations that are supporting them and trying to bridge that gap in the designing of the policies, but also just the overall systems in and of themselves. And that means looking at, I guess, healthcare policies that will exclude and will sort of really restrict, but also other policies that impact their health in different ways. And so in terms of like participation, there are various models that can be used, and yeah, we have some research on it and different practices on how from the very beginning we can do this. But I just wanted to first, I think, bring back from our side the fact that if people are already invisible within the system, designing policies with them will be very complicated, because for an undocumented person to make him or herself visible leads to high risks for them. Because in many cases, just the fact that they have an irregular migration status might lead to migration enforcement decisions that are extremely violent and that don't take into account their needs. So I think that question of participation has to also understand that very complex situation that different groups will have.
Thank you. Some good points from you both. Louise and Keenan, stay with us. We'd very much like you to hear what these amazing brains in here have done with their brainstorming to come up with some solutions, some ideas. So, and then I'd like to come back to Louise and Keenan towards the end to see what you make of that. I have two trusty helpers here, Philippe and Tanya, who are going to come round with a microphone. Philippe's over there. I'd like to ask the facilitators, what are the key messages they've found? Let's look at research and data. Lisa, first, what about your table? What are the key things that have come up? What's scribbled all over the table there?
So we've, can you hear me? Yes. Yes. So I've had very creative and very, very active people at my table. So research and data sounds very dry, but it's not. So I've tried to kind of collect 4 main points that my trusty table people have collected. One of them is actually we've just had a very interesting conversation about the pathways that data takes and the barriers to that data and that information, if it exists at all, obviously. So getting from kind of nation states or member states to DG Santé or DG Klima et al. And going through the member states and the different organizations there. We've had in the first round some discussions about the inclusion of NGOs, of different stakeholders, partnerships, networks. So how this data is used and collected and how it makes its way up the ranks, so to say, to really create also action on an EU level is one of the things. Then the question of what do we do with that data? Obviously awareness is always talked about and a big issue, but awareness is connected to trust. So we can keep showing pictures of glaciers that are melting, but that doesn't automatically lead to some kind of action. So it's also about trust building, about network building, about connecting stakeholders and making people aware. It's obviously a political discussion as well. It's not a neutral discussion to use the data that we have or collect information, especially in marginalized communities. And then last point, kind of the velocity, the quickness of the data, right? How quickly can we actually collect data? How quickly does it make its way into action? When do we get it? Who does it? Who collects it? Who has access to it? And how and when do we act on it? And one of the most interesting, maybe a discussion point also for our panel is, do we always need data first to do something, to create some kind of action taking? Because oftentimes, especially in my own research work, the experiences are there, especially in NGOs and in organizations. So is there maybe even a different way to talk about research and data and acting on it within the urgency of the climate crisis?
Lisa, thank you. Certainly not dry. Lovely. And also on the research and data, let's go over to Vanessa Lopez, who's going to tell us about the key findings from the participants on your table.
Hello. Yeah, regarding the, it's working, right? Yeah. Regarding the data, the baseline for each group to understand the behaviors, the needs, and in a very deep way of each group of marginalized population, they should be part of the research groups as well in order to define the research gap and the questions and also how to use the data. Also, linked to this idea, we mentioned that is needed both quantitative and qualitative data for this group, and also, well, NGOs could be an important source of this kind of information. Also, the desegregation of data, really important. Also, regarding the kind of data that we need as well, would be about how to, to look at the future, how the climate change is going to impact different health conditions in the future, for instance, malaria. Also, how the climate change is impacting on the function of the health system, the pressure that the system is having. Also, we need more research about the continuum of vulnerability, not only about the categories we are talking about. And also, well, and regarding how to use data, we mentioned that is needed, of course, resources and leadership to set this research agenda and to collect this kind of data, and also to be very carefully about how to use it in order to avoid discrimination and stigma. Also, we have to be better in communicating the evidence and the data because, well, people feel that the public and policymakers know a lot about heat, for instance, and how it impacts on health, but less about how the health system is impacting on climate change. And
you were busy.
Sorry, this is to finalize. And also, we have to connect data. Yes. For instance, regarding housing, regarding health. I mean, there are many silos, and we have to connect it in order to make to politicians more visible the impact of the policies and the measures. And that's all.
Thank you very much indeed. My gosh, that was comprehensive. Let's come to the front here to Milka. We're going to be considering the health in all policies. Milka, what are the key findings that your tables have come up with?
Thank you. So indeed, the task was to examine the role of policy frameworks and public engagement in addressing the climate health justice issue, because we can't just say climate and health, we have to add justice to it. So we started from health in all policies, and the discussion went around specifically prioritizing marginalized groups in all policies, including health policies, agri, environment, and also a comment was made on specifically focusing on migration. There was a specific example of a policy ask, if you want, and that was that in Housing First program, for instance, the climate considerations should be incorporated. We also had a comment on integrating climate health justice into humanitarian and the development nexus. So that was the first kind of group of topics and the ideas. The second went around funding. So a proposal was to make sure that there are climate funds specifically earmarked for marginalized communities. There was a mention of the Just Transition Fund used in these purposes as well. And then we were discussing the engagement to make sure that this issue gets addressed. We discussed the awareness-raising campaigns aiming at different stakeholders, healthcare practitioners among others, because they have a lot of trust or they have they're trusted by the general public, but also public awareness among the general public that there are underserved groups among us who will suffer most. Also, we were talking about communication and upping our communication game, but in order to do so, we were talking about the necessity to have sufficient evidence, and I agree, maybe we don't always need sufficient evidence, sometimes enough evidence is enough, right? And that should be used to emphasize the scale of the issue and also to underpin the win-win. And we also had a nice suggestion, and that is to really learn from the civil society that works in the areas of HIV or tuberculosis. They are the front runners in achieving what they want to achieve. So we should be using their knowledge. And also in terms of engagement, there were ideas to connect with the UN agencies that are on the ground, especially in the crisis response situation. But we do acknowledge that many of the underserved communities do not live in crisis situations. I mean, in their circumstances, it's always crisis. Also connect and engage the community health workers, engage civil society at all levels, and also last but not least, have the representatives of the underserved groups involved in co-creation of solutions, from research, as we were discussing at the tables back there, over policy development, over implementation and evaluation. And I just want to make two final points. One is that there was a proposal to turn health in all policies into environment and health in all policies, and another one, independently, in both rounds sitting at the table, there was a call to change political systems. And I leave you at that.
Oh, that's straightforward then. Thank you, Milka. Again, my goodness, how busy that table has been. Catherine, let's hear from you about the policy issues. What have your busy brains been up to on this table?
Thank you. So we had some great discussion, and we talked about, I think we kind of started off and kind of delved straight into kind of the EU context for health in all policies, and that led quickly discussion that to really health in all policies to actually mean something to people on the ground, it needs to have, you know, the kind of the hyper-local, local, national, regional kind of scale to it. So that's really important. We talked about the challenges of mainstreaming absolutely everything. So we've got, you know, the session, this breakout group was called Health in All Policies, but actually, you know, we're talking today about climate and health, and climate mainstream already exists, so there's an obligation for the European Commission to kind of mainstream climate. So then you're kind of mainstreaming health, you're mainstreaming climate, you're mainstreaming climate and health. And then, you know, you've got, you know, a separate equity commission we spoke about, and then it all becomes really conflated. But also, kind of, we learned in the plenary that if you don't have that really complex, holistic view, that just looking at climate and health for vulnerable groups is actually just too binary and doesn't go far enough. So you need to do it, but it's a really kind of hard nut to crack in a way. You can kind of go around in circles. We talked about the what versus the how of health in all policies. So the how was around literacy and kind of what that means. There's an opportunity, obviously, with like a new commission and a new parliament as advocates to kind of start again and have these conversations about health kind of generally and maybe climate and health in particular. What's the best way of doing it? Does everyone in the commission and the parliament need to be literate in health? Do they need to just consult DG Health on health, but you actually need to be quite literate in health to know you need to consult in the first place. We talked about incentives, so like, why should people do it? There are DGs in the Commission who are like, this is just not my problem for health in all policies, and actually it's been described by one particular EC official as a bit of a box-ticking exercise, which is a bit of a wake-up call for people working in health. So incentives and kind of a budget attached to it, kind of at national level in particular, where we're talking about like training of kind of workers on kind of health issues.
Catherine, can I be very rude and cut across you there, because I want to get the others in, and I know other people have commitments, so thank you. There's so much there, but we are collating all the answers that have been written down, because this is fantastic data. Talk about collecting data. So thank you for those insights, and if I may, we'll pass the microphone to Freek, who's going to talk to us about adaptation and best practices. Again, forgive me for asking you to be brief on this one.
Yes, I was also a terrible chair, and we had more nice conversation sticking to the topic. But still, 4 quick points, very quick. I think we realized that already talking about best practice. Maybe it's too early to talk about best practices because they don't necessarily exist already. Like we have to start creating them. So that's one thing. I think the other thing is that it's not because climate change is with us now that the old solutions for the problems that these population groups had are not relevant anymore. The solutions that were proposed before are probably solutions that are best to protect people against climate change. Just to give the example of homeless people, if you want to solve homelessness, you have to house them. But housing is probably the best protection against climate change for homeless people. So I don't think we have to reinvent all these solutions. I think we can rethink the solutions a little bit, but they still remain valid, even in the context of climate change. I think there was also a call for data and monitoring, etc. Even if there's limits to that, but it remains important. There was exactly the same suggestion here as there, to steal ideas from the HIV/TB community, how they managed, even if they focus on vulnerable groups, to get the issues high on the agenda. So we'll have to look into their secrets.
Lovely. Let me pass it on to Rosaline then, because you've got some really good points there. Rosaline Mbeo, on your table, any other points in addition to what we've already heard? What have your table come up with?
We came up with some best practices.
They do exist.
They do exist at local levels. We have one of first response network in Netherlands, that's where people are being trained for emergencies when they see people in the street, regardless of whether they have documents or not, that they should be, taken care of. And we have in Germany, there is a law for systemic prevention at the workplace, because you have people working, we have a lot of migrants that are working, and maybe some are undocumented working, and if something happens to them, there is a law that people that are working, that they should, there should be some sort of prevention. And also we have doctors reach out in other places that once in a while doctors go out in the streets and then help people that are having problems and challenges. And also one of the key issues is combating stigma and discrimination. That's very, very important. Yes. And also, bringing the voices of the people. And sustainable health promotion at the workplace is also very important. And we want revolution and not evolution. That was the key point. And we also have places like in Berlin, there is a checkpoint where people that are undocumented, anybody that have health needs can go there. So there are some good examples around the area.
Great, that's lovely. Rosalind, thank you very much indeed. We're getting close to the end, and we've still got Louise and Keenan with us. I hope you were able to hear all those amazing solutions, and you've been taking copious notes. We haven't got long, so I just want to ask you to look ahead in the future. Luckily, I've brought my crystal ball with me. I carry it everywhere, but if you look through your crystal ball into the future, I want you to tell me, Keenan first, looking into my crystal ball, if you can see it, what do you see for the future? Is it a positive? Is it a frightening future? What do you see in my crystal ball?
Honestly, it's not a positive. I think the trend when it comes to the rights of LGBTI people and their protection in Europe and around the world is a negative one. In the near future, at least, we're seeing increasing polarization and the rise in populism, which has a negative consequence for LGBTI people and their lived experience, and also for climate and the way that we react to the climate catastrophe. So I think that we're going to need some pretty significant political investment and political will to be able to turn this situation around. Do I think that that's possible? Absolutely. But will it happen if we coast along in the mechanisms and methods that we're using now? I'm afraid that it looks a bit bleak in that crystal ball for me, unless there's some significant change.
Thank you, Keenan. And Louise, looking into my crystal ball, what do you see? Louise, do you see something positive? What do you see in the future? Or maybe what would you like to see in there?
Oi, oi. I'm afraid I can't be more positive than Keenan. We see the exact same trends. I think it's something that we see across all sort of human rights questions in Europe, across all vulnerable groups or groups in general. So rights are really at stake right now. And somehow, even though we have strong legal standards, whether that's at international, European level, they're not being upheld by member states, by local authorities, just across the board. So I think it's unfortunately not a very bleak future if we don't mobilize together, and I think we can. I think the fact that we're able to speak about these questions together means that there are people out there who are willing to look at these questions and to see how we can solve it or take it on board. And especially right now, I think it's already been mentioned, that we are facing numerous elections across Europe this year and also with the next European Parliament. So I think there is a moment to be able to mobilize, even just as an individual voter. Maybe I should leave it at that. But just to say that from the perspective of migration, we are seeing an increasing criminalization of people in an irregular migration status, and that soon there will be a European Pact on Migration that will even strengthen the practice across Europe, and that impacts everyone, regardless of their migration status or not. And some countries are even considering putting in place stronger duties for everyone to report people to the migration authorities. So I just want to sort of really bring caution to everyone and want everyone to sort of think about how, everyone is being impacted by this change, whether that's in migration or LGBTQ rights or other rights, sexual and reproductive health. There are thousands of different areas that we need to be thinking about. So
thank you, Louise. Thank you, Keenan. Thank you to all our speakers. And I'm glancing into my crystal ball, and luckily it's magic. And so all the great ideas that you've come up with at your brainstorming world cafe tables, I'm going to grant them through the magic of my crystal ball. You have made some great ideas. We've had a fantastic discussion. Thank you all very much for participating. Thank you for everyone who joined us online, everybody here in the room, everybody who put their questions in and their thoughts. Thank you to the organizers, to NLO, to Wellcome Trust, to our host, Boris Zayas. It's been an amazing afternoon, and let's hope this is going to make a real difference. Thank you all very much indeed. Thank you.
Thank you, everyone.